Hi, my name is Alicia Walker, and I'll be doing my medical administration checkoff here. So first, I'm going to show you my name badge to show you that I am me. And now I'm going to scan the room, showing that I have no notes. Here are my supplies. And back around we go. So first, I'll be making sure I'm in a no interruption zone, making sure that all the doors are closed, that I have limited interaction with my colleagues, and that I'm taking no phone calls. So first, I will compare my order form with my MAR to make sure that everything matches. So, Jaguar J. Jones, medical number 4176352, 4176352, medication, Novolin R insulin, dose 10 units, route subcutaneously, and 30 minutes before meals. So that would be the right time. And indication would be to regulate blood sugar levels, and documentation, something I will do later. So now that I know that everything matches, I can put my order form away and start my first set of the 7 rounds of medication. So first I perform hand hygiene. Now I would do right patient. So making sure that I got Jaguar J. Jones with medication number 4176352. Next is right medication. I would compare my medication with the MAR. So Novolin R insulin, and checking the expiration date. It is December 1st, 2025, so it is still good, and I will show you that it matches. Novolin R insulin with the expiration date of December 1st, 2025. Next is route. So it is subcutaneous, and I will be using a subcutaneous insulin syringe. Sorry. Now, right dose, it is 10 units, and thankfully my syringe is in units, so I do not have to do any calculations. So I will first clean my vial. Circular motions, making sure not to touch it with my fingers. I'm gonna draw back 10 units. So that's 10. Checking one more time that it is 10 units. It is. So now I can flip and draw 10. That is 10. So now I can recap. And show my nurse who's double checking me that I've correctly drawn up 10 units. Hopefully you can see that. I think you can see it. try to draw it up closer. Maybe I should hold up my left hand, make it easier. Okay, and since this is a safety lock, I can safely put it down. So far done right patient, medication, dose, route. So right time, it's 30 minutes before a meal. It's at least 30 minutes before his next meal. Right indication to regulate his blood sugar levels, and right documentation I will do at a later point. So now that I know my first check is all good, I will check it one more time before I drop a label for my medication. So, patient Jaguar J. Jones, medication number 4176352, right medication, Novolin R insulin, Novolin R insulin, showing again that it is the right one. Right route, it is subcutaneous, and I am using a subcutaneous insulin needle. Right dose, 10 units. I have correctly drawn up 10 units, which you have seen. Right time, 30 minutes before a meal. Right indication to regulate his blood sugar levels. And now for right documentation. So I will drop a label using tape. I will write down my patient's name, the drug in question, and the dose. So using my MAR, I am making sure I write the patient's name correctly. Jaguar J. Jones. Medication, Novolin R insulin, Novolin R insulin. Right dose, 10 units, and this is 10 units. That's the tricky part. And here's my label. Hopefully you can see that. So that concludes my second check, or my second check of the 7 rights. So now I will be leaving the room. I would take the medication, the syringe, and my MAR to go to my patient's room. So now I set up. I will now be putting my patient's armband in front of me. So I have my source container, pair of gloves, skin pad, goggles, and a backpack. Let's see if I can move this more. See everything work correctly. Okay. So this is me going to my patient's room. I would have performed hand hygiene. I would have made sure I got the right patient. So Jaguar J. Jones, medication number 4176352, 4176352, and allergies, penicillin. So now I know I have the right patient. I will have informed my patient what I am doing. I am administering insulin before your next meal. So I would have done anything that would have been needed to be done. So for insulin, I would have possibly done a lab test to possibly see what his glucose levels are like right now. Or for any other medication, I would have checked his blood pressure or his heart rate. Okay, so right patient, Jaguar J. Jones, penicillin, right medication, Novolin R insulin, and comparing my valve, Novolin R insulin, and comparing the syringe itself, Novolin R insulin. I would have gone back, so I have to compare the name band, the MAR, and the syringe to check for right patient. So Jaguar J. Jones, right medication, Novolin R insulin, Novolin R insulin, right route. It is subcutaneous. I'm using a subcutaneous needle. Right units, it is 10 units, and I have correctly drawn up 10 units. Right time, 30 minutes before meals. I will be administering this 30 minutes before his next meal. Right indication to regulate your blood sugar levels. So now I will start to safely administer the medication. So I'll put this down right here. I will have put on my goggles and gloves. So I will correctly clean the skin, starting at the center of where I would inject and then circling out. So making sure not to correct the same place twice. I'm gonna leave this here to show where to inject. Okay, so now for subcutaneous, I will pinch the skin. If I can pinch the skin to 2 inches, I would inject at a 90-degree angle, but if I can only pinch the skin to 1, I will inject at a 45-degree angle. So for now, I'll pinch, inject at a 90-degree angle, inject, and I will not aspirate. Now we will show I injected. This will go in my sharps container now. So that process is over. So now I can safely leave the room. I would wait and come back on my patient to check that she is all right. And now I can perform right documentation on my MAR. So I administer the patient at whatever time. I will write down that I administered the medication at whatever time it was. So right now, I can't check the time, but I will write that it is 7:30. The route dose and my initials. And that is the 7 routes of administration check off. Thanks for having me.